I'd like to welcome you to the first full-length course in our Visceral Osteopathy series, Part 1, treating the upper gastrointestinal tract, meaning the esophagus, diaphragm. Let me introduce myself. My name is Maureen Hannah Mahar. I'm the Educational Director for the Center for Continuing Education of Osteopathy, and I'm also the instructor for this course. I wanted to give you a bit of an overview of what you can expect to learn, specifically the type of demonstration videos that we're going to give you aside from all of the theory knowledge, so that you can have an idea of what to expect as you go about deciding whether or not you want to enroll, and as you go about deciding whether or not maybe visceral osteopathy is something that you should consider incorporating into your practice, because it's not always self-evident in every training course throughout the world that the gastrointestinal tract has a lot of effects on the body and can be very well treated through manual osteopathic therapy. So let me jump right in and give you a bit of an overview. Now, for the purposes of this course, because we're looking at the upper GI tract, and of course, even though within osteopathic principles everything is interconnected, for the sake of learning and pedagogy in an organized and incremental way, I've had to break up the entire digestive tract into sections or regions. And this course, as you know, we are going to be covering the upper GI tract, so the beginning of the digestive tract. And the upper GI tract, as you know, consists of the esophagus and the diaphragm, which is a very important muscle through which the esophagus transverses so that it can then dump food into the stomach. Now, a lot of things can go wrong within those areas because, as we know, things like acid reflux are often caused by problems, like I say, within the plumbing of the upper GI tract, the beginnings of the whole system. And we see this type of phenomenon in women who are pregnant because the weight of the baby is pushing up the upper organs, or we see it in people who are suffering from emotions or nervous emotions that are related to agitation within the stomach, affecting the production of hydrochloric acid within the stomach. And we can also see spasms within the esophagus itself. And you'll see that when we come to discussing how the esophagus actually is positioned within the body and its purpose and its way of functioning, we can understand that if there is a certain degree of hypertonicity, too much stress or tension within the chest cavity, the esophagus can end up being in a state of spasm, and therefore the food has difficulty going down. So when it comes to palpating or evaluating with your hands, we're going to do it in a progressive manner, always in the direction that the digestive tract moves. So I've already said, if you think of the digestive tract like an assembly line, well, the food leaves your mouth after you swallow, and then what does it do? It starts sliding down your esophagus. It gets to the base of your esophagus, whereby it passes through the diaphragm. So the diaphragm has to be in a proper state of function in terms of its tone as a huge muscle. If there's too much tone, too much tension within the diaphragm, then the esophagus is going to have difficulty allowing the food to slide down in a natural way, the way it should, and then dump into the stomach. So we're going to be, first of all, assessing for any dysfunction within the esophagus, within the structures surrounding the esophagus, which is within the thoracic cavity. We're going to also be assessing for the diaphragm because, as I mentioned, if the diaphragm is too tight, if a person is stuck in inhalation, if there's a variety of reasons why the diaphragmatic muscle is so incredibly tight, then it is going to prevent food from going down. It's going to sit at the bottom or at the base of the esophagus, but it's not going to be able to migrate any further down its production line. So we're going to need to assess, palpate, and evaluate the diaphragm as a muscle itself and make sure that that's functioning properly. That'll go a long way towards not just allowing the food to be able to transverse through the diaphragm and dump down into the stomach, but also in relieving a lot of intrathoracic pressure. We know if a person is stuck in inhalation, what's happening is everything is getting pulled upward. There is a difference in the pressure gradient between the chest cavity and the stomach cavity, and that in itself can also cause abnormal tension or tone on the esophagus. So you're starting to see how it's all interrelated. And that's the beauty of osteopathy. Now, in our following demonstration videos, I'm going to show you how to test for and treat the esophagus, what you're going to look and feel for within the fascia in that area, within intrathoracic cavity pressure, and then to go about treating and releasing restrictions in that area. Then we're also going to learn how to palpate and test for problems within the diaphragmatic muscle. We're going to learn how to treat that successfully in order to help it release. And we're going to learn how to do that in a prone position and also in a seated position. And the beauty of learning a variety of techniques, whether it be the patient lying down or whether it be the patient sitting up, is that you have different tools in your toolbox that you can reach for depending on what's appropriate and comfortable for you and for your patient at the time. So don't be afraid to move your client around so you can break up your practice in learning how to master the techniques in as many different ways as you want as you go about watching these videos. So that gives you an overview of what our goal is in terms of our video demonstrations. Let's move on, let's move forward, and let's take a look.